The high one reaches 10.8 billion. The low projection, which assumes that the world will quickly move below replacement level fertility to 1.6 children per couple, has population peaking at just under 8 billion in 2041 and then declining. If the goal is to eradicate poverty, hunger, and illiteracy, we have little choice but to strive for the lower projection. Slowing world population growth means that all women who want to plan their families should have access to the family planning services they need. Unfortunately, at present 201 million couples cannot obtain the services they need. Former U.S. Agency for International Development official J. Joseph Spiegel notes that if you ask anthropologists who live and work with poor people at the village level, they often say that women live in fear of their next pregnancy. They just do not want to get pregnant. Filling the family planning gap may be the most urgent item on the global agenda. The benefits are enormous and the costs are minimal. The good news is that countries that want to help couples reduce family size can do so quickly. My colleague Janet Larson writes that in just one decade Iran dropped its near-record population growth rate to one of the lowest in the developing world. When Ayatollah Khomeini assumed leadership in Iran in 1979, he immediately dismantled the well-established family planning programs and instead advocated large families. At war with Iraq between 1980 and 1988, Khomeini wanted large families to increase the ranks of soldiers for Islam. His goal was an army of 20 million. In response to his pleas, fertility levels climbed, pushing Iran's annual population growth to a peak of 4.2% in the early 1980s, a level approaching the biological maximum. As this enormous growth began to burden the economy and the environment, the country's leaders realized that overcrowding, environmental degradation, and unemployment were undermining Iran's future. In 1989 the government did an about-face and restored its family planning program. In May 1993, a national family planning law was passed. The resources of several government ministries, including education, culture, and health, were mobilized to encourage smaller families. Iran Broadcasting was given responsibility for raising awareness of population issues and of the availability of family planning services. Some 15,000 health houses or clinics were established to provide rural populations with health and family planning services. Religious leaders were directly involved in what amounted to a crusade for smaller families. Iran introduced a full panoply of contraceptive measures, including the option of male sterilization-a first among Muslim countries. All forms of birth control, including contraceptives such as the pill and sterilization, were free of charge. In fact, Iran became a pioneer, the only country to require couples to take a class on modern contraception before receiving a marriage license. In addition to the direct healthcare interventions, a broad-based effort was launched to raise female literacy, boosting it from 25% in 1970 to more than 70% in 2000. Female school enrollment increased from 60 to 90%. Television was used to disseminate information on family planning throughout the country, taking advantage of the 70% of rural households with TV sets. As a result of this initiative, family size in Iran dropped from 7 children to fewer than 3. From 1987 to 1994, Iran cut its population growth rate by half. Its overall population growth rate of 1.3% in 2006 is only slightly higher than the US growth rate. While the attention of researchers has focused on the role of formal education in reducing fertility, soap operas on radio and television can even more quickly change people's attitudes about reproductive health, gender equity, family size, and environmental protection. A well-written soap opera can have a profound short-term effect on population growth. It costs relatively little and can proceed, even while formal educational systems are being expanded. The power of this approach was pioneered by Miguel Sabido, a vice president of Televisa, Mexico's national television network, when he did a series of soap opera segments on illiteracy. The day after one of the characters in his soap opera visited a literacy office wanting to learn how to read and write, 250,000 people showed up at these offices in Mexico City. Eventually 840,000 Mexicans enrolled in literacy courses after watching the series. Sabido dealt with contraception in a soap opera entitled Accompany, which translates as Come With Me. Over the span of a decade, this drama series helped reduce Mexico's birth rate by 34%. Other groups outside Mexico quickly picked up this approach. The US-based Population Media Center, PMC, headed by William Ryerson, has initiated projects in some 15 countries and is planning launches in several others. The PMC's work in Ethiopia over the last several years provides a telling example. The radio serial dramas broadcast in Amharic and oromiffa have addressed issues of reproductive health and gender equity, such as HIV/AIDS, family planning, and the education of girls. A survey 2 years after the broadcasts began in 2002 found that 63% of new clients seeking reproductive health care at Ethiopia's 48 service centers reported listening to one of PMC's dramas. Among married women in the Amhara region who listened to the dramas, there was a 55% increase in those who had used family planning methods. Male listeners sought HIV tests at a rate 4 times that of non-listeners, while female listeners were tested at 3 times the rate of female non-listeners. The average number of children born per woman dropped from 5.4 to 4.3, and demand for contraceptives increased 157%. The costs of providing reproductive health and family planning services are small compared with their benefits. Joseph Spiegel estimates that expanding these services to reach all women in the developing countries would take close to $17 billion in additional funding from both industrial and developing countries. The United Nations estimates that meeting the needs of the 201 million women who do not have access to effective contraception could each year prevent 52 million unwanted pregnancies, 22 million induced abortions, and 1.4 million infant deaths. Put simply, the cost to society of not filling the family planning gap may be greater than we can afford. Shifting to smaller families brings generous economic dividends. For Bangladesh, analysts concluded that $62 spent by the government to prevent an unwanted birth saved $615 in expenditures on other social services. Investing in reproductive health and family planning services leaves more fiscal resources per child for education and healthcare, thus accelerating the escape from poverty. For donor countries, filling the entire $7.9 billion gap needed to ensure that couples everywhere have access to the services they need would yield strong social returns in improved education and healthcare. Better health for all. While heart disease and cancer, largely the diseases of aging, obesity, and smoking dominate health concerns in industrial countries, in developing countries infectious diseases are the overriding health concern. Besides AIDS, the principal diseases of concern are diarrhea, respiratory illnesses, tuberculosis, malaria, and measles. Child mortality is high. Progress in reaching the MDG of reducing child mortality 2/3 by 2015 is lagging badly. As of 2005, only 32 of 147 developing countries are on track to reach this goal. In 23 countries, child mortality has either remained unchanged or risen, and only 2 of the World Bank's 35 fragile states are on track to meet this goal by 2015. Along with the eradication of hunger, ensuring access to a safe and reliable supply of water for the estimated 1.1 billion people who lack it is essential to better health for all. The realistic option in many cities now may be to bypass efforts to build costly water-based sewage removal and treatment systems, and to opt instead for water-free waste disposal systems that do not disperse disease pathogens. See the description of dry compost toilets in Chapter 10. This switch would simultaneously help alleviate water scarcity reduce the dissemination of disease agents in water systems, and help close the nutrient cycle, another win-win-win situation. One of the most impressive health gains has come from a campaign initiated by a little heralded non-governmental group in Bangladesh, BRAC, that taught every mother in the country how to prepare oral rehydration solution to treat diarrhea at home by simply adding salt and sugar to water. Founded by Faisal Hassan Abed, BRAC succeeded in dramatically reducing infant and child deaths from diarrhea in a country that was densely populated, poverty-stricken, and poorly educated. Seeing this great success, UNICEF used BRAC's model for its worldwide diarrheal disease treatment program. This global administration of a remarkably simple oral rehydration technique has been extremely effective, reducing deaths from diarrhea among children from 4.6 million in 1980 to 1.6 million in 2006. Egypt alone used oral rehydration therapy to cut infant deaths from diarrhea by 82% from 1982 to 1989. Few investments have saved so many lives at such a low cost. The war against infectious diseases is being waged on a broad front. Perhaps the leading privately funded life-saving activity in the world today is the childhood immunization program. In an effort to fill the gap in this global program, the Bill and Melinda Gates Foundation invested more than $1.5 billion through 2006 to protect children from infectious diseases like measles. Additional investment can help the many countries that cannot afford vaccines for childhood diseases and are falling behind in their vaccination programs. Lacking the funds to invest today, these countries pay a far higher price tomorrow. There are not many situations where just a few pennies spent per youngster can make as much difference as vaccination programs can. One of the international community's finest hours came with the eradication of smallpox, an effort led in the United Nations by the World Health Organization, WHO. This successful elimination of a feared disease, which required a worldwide immunization program, saves not only millions of lives, but also hundreds of millions of dollars each year in smallpox vaccination programs and billions of dollars in healthcare expenditures. This achievement alone may justify the existence of the United Nations. Similarly, a WHO-led international coalition, including Rotary International, UNICEF, the U.S. Centers for Disease Control and Prevention, CDC, and Ted Turner's UN Foundation, has waged a worldwide campaign to wipe out polio, a disease that has crippled millions of children. Since 1988, Rotary International has contributed an extraordinary $600 million to this effort. Under this coalition-sponsored global polio eradication initiative, the number of polio cases worldwide dropped from some 350,000 per year in 1988 to fewer than 700 in 2003. By late 2007, only 10 countries were still reporting polio cases, including Afghanistan, India, Myanmar, Pakistan, and several countries in Central Africa and the Horn of Africa. The number of cases reported worldwide dropped from roughly 2,000 in 2006 to 545 during the first 9 months of 2007. A reinvigorated program in Nigeria was on the verge of eradicating polio there. For the coalition, the prospect of total eradication was within its grasp. But once again, hardline clerics, this time in a remote region of Pakistan, began saying that the vaccination program was a U.S. conspiracy to render people infertile. Health workers have been attacked and driven from parts of Pakistan's northwest frontier province, where the polio virus still exists. 2 workers have been killed. A small group of people refusing to cooperate with the initiative could prevent the eradication of this dreaded disease for all time. One of the more remarkable health success stories is the near eradication of guinea worm disease, tuberculosis, a campaign led by former U.S. President Jimmy Carter and the Carter Center. These worms, whose larvae are ingested by drinking unfiltered water from lakes and rivers,